Welcome to Designing Healthcare That Cares, the show where we explore how to build healthcare systems where people and performance thrive. I'm your host, Dr. Laura Suttin, a physician, coach, and healthcare leader who believes that human flourishing and organizational excellence go hand in hand. Each week, I talk with leaders, change makers, and innovators about how to shift culture, lead with purpose, and tackle the root causes of burnout. Because when healthcare works for the people in it, everyone wins. We know inherently that we can't take care of our patients, nevertheless, our families and our communities, unless we're taking care of ourselves. And yet there's still so much guilt, at least that I felt in my career and talking with a lot of my colleagues and working with my clients. There's a ton of guilt around doing things for ourselves, even the simple things like sleeping, eating, going to the bathroom, exercising. And I imagine as an emergency physician, that was amplified. I did primary care, and any training program is going to be really intense. So I think there's just such a mentality still in our environment around not taking care of ourselves. I'm curious, when did those thoughts and ideas start to come to you as far as like, hey, we need to take care of ourselves in order to take care of our patients? And I love the analogy about decreasing the forces against the tree. It's, yes, how do we maintain those strong roots? How do we make sure we're going to bend and not break? But also, how do we decrease the wind shear and the wind power that's coming at us? So, how's that evolved for you in your life and your career?
Well, thank you for asking that. And I appreciate that. I think like most people, I have my own personal journey. I'm also married to another physician who's an emergency physician. So I kind of get the two sets of data at the same time because my spouse does the same thing. She also is in emergency medicine. So you're absolutely right. I would even double down on the comment of the eat, sleep, exercise, those sorts of things. When you're under stress, a lot of the time, just human nature, those are the first things to go. Is if you have a lot of pressure and you have a lot of deadlines or things building or a lot of patients backing up, then forget it. I'm not going to eat during this shift. There's no way I'm going to be able to, go to the bathroom. And we used to joke about if spontaneous bladder rupture was actually a thing, like could that actually happen if you didn't go to the bathroom for an entire ER shift? So it became comical, but the point I'm getting at is, I had my own personal journey where because of making those decisions and sacrificing those critical elements, I started to get to a place where I was starting to go downward and not feel well and not be able to bring my best self. And then one of the things that turned that around was when I went back to school and went to the program, that MHCM program that was at Harvard. There was a lot of organizational behavior, a lot of pieces of that program that I hadn't expected that were really transformative. And it really did call into question, like, what kind of structure are we building to sort of reinforce that, to enculturate that, to make that okay? And then how do we start to unwind that? Because we're really grinding people just into fine powder to try to get the most productivity out of them. And so it was a call to action to really say, we're all the people in that program are physician leaders that have been in leadership roles for quite some time, to say it's on us to try to figure out a way to do better. So it was really a call to action that was really transformative for me in my career, on top of my own personal learning the lesson the hard way, like so many of us unfortunately have.
Yeah, it sounds like that was a huge insight for you. And I completely agree and echo and resonate with everything that you're saying. And my own path as a physician leader and coaching other clinician leaders, which is really kind of my sweet spot, is clinicians that are moving from full-time practicing clinician into leadership roles, and what all, not just the how to be a leader, but all the mindset shifts that are required in that, is really recognizing that the behaviors that I am actively doing myself are impeding my team's ability to be successful. So for a CMO or COO example might be, well, I'm emailing late at night. And so that sets up a standard and an expectation that my direct reports and my team expect that they feel like they have to be able to be responsive at night. They have to be emailing at night, when really I'm doing that because it's when I can sit down and have time. But what's the message that I'm sending? What's the expectation that I'm setting with my team? In a clinical setting, it might be just like you said, am I taking the breaks that I need? Am I sleeping enough? Am I eating enough? Am I taking bathroom breaks? Am I stopping to process the emotions that are coming up? And I think I'm starting to see a real awareness now in our physician leaders and clinician leaders that, yeah, the ways that I take care of myself have a direct impact on the way that the people around me take care of themselves. And I need to walk the walk. If I'm going to encourage this healthy environment around me, I have to also be the one to take on these behaviors and to start modeling this for myself. And even within practicing clinicians, I hear this from clients too as well. I'm telling my patients they need to be sleeping and I'm telling them they need to be eating healthier, but I'm not doing it.
Right. Right.
And so this recognition that we, back to what we were saying, we really can't take care of each other until we learn how to take care of ourselves. And then it's a
Yeah.
ripple effect, it's a domino effect, then everybody wins.
Yeah. No, absolutely. 100% agree for sure. And, maybe to put some sort of concrete examples of things
Yeah.
that I found to be really effective. You can start on the macro scale. At least that was something that I had a bit of some influence on, which really comes down to things like staffing and how many people are doing this job and how many patients per hour, like in the emergency department, for example, are you expected to see? How quickly are you expected to fly through patients versus sitting down, spending some time connecting with people, going through their differential and how you arrived at what's going on and educating them, things like that. So there's a tipping point, obviously, where you want to try to find that sweet spot and looking at the specific tasks that you're asking physicians, for example, to do. Do they really need an MD degree to do all these things, or could they be potentially done by someone else? And then you get into scribes and EMRs and a whole bunch of rabbit holes we could go down. But the point is, you can look at those macro pieces and start to sit down with the clinicians and see where are we, or how far off center are we, and what adjustments can we make. And then, like you said, sometimes it's just modeling very simple things. And I know your audience likes little practical tasks and things or tricks they can do. And one thing that one of my professors at school taught me was that if you're looking at really peak performing athletes, as an example, like a tennis player in between each serve will do a ritual where they bounce the ball, they take a few deep breaths, like they go through a routine. And if you've ever watched a tennis match, you can see that there's very ritualistic and they do it every single time and they
Mhm.
reset. And so I started to adopt that in my clinical practice, where even just before I would go in, or maybe I'm washing my hands, I would greet a patient or a family, say, "Hi, I'm a dirty doctor. I don't know where I've been. I'm going to wash my hands." It's kind of a duo because you get a hand hygiene thing,
Yeah.
which my infection control nurse colleagues love. But then I would just sit and wash my hands for a second at the sink. And that was my sort of reset moment where I would take a breath. I would just shake off all the other patients that I had running around in my head, all of the stress of the rest of the emergency department. I knew I could trust my colleagues and the nurses that I work with, that if something was really going badly, they would come and grab me and interrupt me. But I would really train myself to spend that time focusing on this particular encounter, this particular patient and family. And so just a little reset ritual. I'm no professional tennis player, but I found even those micro moments and getting in the habit and the discipline of doing that in between every single patient, it just brought my whole nervous system down a notch and I was able to focus more. And patients can track that, they can pick up on it. So it
Yeah.
goes from big scale things to little microscopic things. And if I think, you're modeling those things, like you said, both in your own behavior as well as, speaking about examples like that and giving people suggestions of things they might consider, then I think you can really move the dial and people start to pick up on these and they take some of them, throw out the rest, and that's fine, but they may make a difference for each person.
Yeah. I love that example. And yeah, I don't watch a ton of tennis. I know we've just finished the US Open. I'm a basketball fan being in San Antonio. We love our Spurs,
Yeah, free
despite how
throws. There you
terrible
go.
they are.
Yeah.
So, but yes, free throws is every player has their own ritual that they do before a free throw, and they all involve a
Yes.
deep breath. Some of the crazier ones over the years have involved licking their hands, licking their feet. Oh, who was it that used to? Steve Nash. He
Yeah.
used to
Yeah.
wipe his hands on his feet and then lick his hands, which I just still to this day found find
Yeah, I'm
incredibly.
not sure I would advise that
I wouldn't
universally in a
advise that
clinical
again
setting,
from
especially. Yeah.
infection control,
Yeah.
but it worked for him. And so, yeah, these ritualistic things that don't take time. And I'm sure you hear that. I hear that as a barrier. Well, I don't have time to implement any of these other techniques. And, but like you said, these micro moments, and when you're bringing the patient in, and yeah, I led infection control for a long time too. And when you can tell the patients, this is what I'm doing and this is why, then it really serves multiple purposes. So that's a really powerful example.
And I would push on the time thing because I think you agree with this, but it's easy to say I don't have time to do that. But if you think of it as sharpening the saw, you're going to be much more focused. You're going to be much more efficient during that encounter. You're not going to miss things. You're going to be much more on point. And when
Mhm.
you're hyper focused like that, you will actually get through that encounter and gather what you need to help that patient much more quickly. So
Mhm.
it's kind of the, that old analogy of if you only have so much time to cut down a tree, spend the first chunk of it sharpening the saw.
Yeah.
So to me, those rituals are really about making sure that you're sharpening the saw and making the work time that you use as efficient as possible.
Yeah. Yeah. Really, really powerful.
Yeah. And if I may, I've been recently even doubling down on that and been putting some posts out on LinkedIn, just more of the neuroscience. That's the part that for some reason I just find really fascinating.
Yeah.
And I'm sure you've had this phenomenon happen too, but during times where you're in those sort of even micro moments of rest, or you're going through a ritual, or you're maybe in between things, the biggest example is if you've ever had like an aha moment in the shower, or like when you first wake up and you're sort of half sleepy. There's a whole set of science behind why that sort of thing happens. And so I've been putting out more information just to hopefully help people understand why, because I'm a little obsessed about why things are the way they are. But the whole design behind that is really taking away that guilt of taking a moment to pause and thinking it's wasted time, and actually emphasizing the fact that there's a whole entire part of your brain and a whole another kind of bucket of creativity and innovation and problem solving that happens, but that can only happen when you're in that sort of relaxed state where you're not hyper focused on something.
Hmm.
And so if you've ever walked into a party, saw somebody and you just couldn't remember their name, and you're like, oh my God, I totally know this person's name. I just can't access it. It's like the neurons just won't connect. And the more you try and try and try, it's at the tip of your tongue, and you just like, it's so elusive and you can't get it.
Hmm.
But then you go off to somewhere else in the party, and 10 seconds later, you're like, it's Laura. Oh my God. And it's not like I think it's Laura. It's like, oh, it's 100% Laura. And I know exactly how I know her. Like it was in there the whole time. You
Yep.
just couldn't make the wire connect. I find that kind of stuff fascinating, but
Yeah.
that's the point I'm getting at, is that not only to not feel guilty about taking those pauses, but to recognize there's a whole set of work that your brain can do and solve problems and connect things and do some pretty cool stuff that it can only do when it's in that state. And if you're constantly hyper focused and driving, your brain just is shut off. That entire network of your brain is shut off and you can't access it, which is a tragedy. So it's just redefining what productivity is all about. And it takes the guilt away from those pause times and says, wow, wait, this is actually necessary. How else are we going to come up with innovations and solve really challenging problems without tapping into that whole other part of your brain? So
Yeah.
I think
Yeah.
it's fun. I don't know if that resonates with you or your audience, but I think it's kind of cool.
Yeah, I think it's fascinating too. I mean, the examples that you brought about like, yeah, in the shower, driving. I'm a runner, so for me when it's running,
Yeah.
for me it's running when I'm running and I don't if I'm on the treadmill, I might listen to music, but when I'm running outside, I don't because I want my brain to work and to create new
Yes.
connections. And usually about a mile in, I'll think of something that I hadn't thought of before, an answer to a question that'd been going on in my mind. And it's really beautiful. I just started reading Deep Work by Cal Newport. I don't know if you've read
Hmm.
it, but
I
it
haven't
talks
read it
all
yet, but I'm
about,
familiar. Yeah.
yeah, it talks really all about that we are crazy busy schedule and technology and notifications and not that there's necessarily anything inherently bad in that, but we've created this structure of constantly being available. And in my clinician leaders that I work with, there's this concept or this sort of duality among between the practicing clinician and the leader, the physician leader, clinician leader. And even how do they physically separate that? So one of my clients is the COO and he's a physician associate. And he says, I have to go, I can't work on my COO job in my clinic because if I'm in the building, they will come find me and they'll ask me questions about patients. And then I can't put on my COO hat and wear that COO hat for the long enough time that I need to really be strategic and solve problems. So I'll go somewhere else. I'll work at home if nobody else is at home, or I'll go to a coffee shop or something. So it's even just noticing, do we have those opportunities to change our physical environment so that we can put our brains in the right mindset? And from a practicing clinician standpoint, how do we set up expectations with our staff? When can they interrupt us? When can they not interrupt us? How do we respond to messages? Are we expected to respond to every single message the second it comes in? And we can't, it's hard to think about seeing patients if you're constantly feeling like you have to respond to messages. And so, yeah,
Yeah.
I feel like we could geek out on that for a long time,
Yeah.
but yeah,
One
that's
thing
really,
I might jump on, if I may, just that
yeah.
makes me think of is, I think it's a good opportunity for either a frontline clinician that might be not in a leadership position, or I can look at it from both perspectives, having been both recently. As a leader, you could potentially help build the structure around, is looking at even something as simple as protected time for that type of work where you just have people sit around and do that non-clinical, just thinking about how can we make things better, how do we solve problems, getting in your brain and everybody's collective brains into that mode. But you don't want to make it the only time off that you have because you're working a million hours and this is like your only day off. That's not helpful. So I
Hmm.
do think from a leadership standpoint, you can create structure where you have some protected time and you see the value in taking the time to do that. And as an organization, you can value that sort of work as high as the clinical work and make time for it. And then as a clinician, you can advocate and push for some protected time
Hmm.
to say, okay, this is important to the organization that you're using my expertise and my brain to help solve this problem. So please recognize that by setting aside some dedicated time, and whether it's buying down some clinical time or adjusting your load or whatever that looks like in your clinical environment.
Hmm.
I think there's ways that both sides can do that sort of thing. But then it's really about proving the ROI, the return on investment, which is another big sort of transformation of the way that I started looking at these things. Was not just looking at the physicians I was working with and trying to show them that we're investing in you with leadership development and education and trying to make this time worth your while so that it's as valuable to you as working clinically or being off, but then also going to the C-suite, the CFO, and saying, listen, this is providing a tremendous amount of value because we're investing in physicians. We're helping them work towards crafting a career that they love. We're looking at what their skills are and helping kind of do more of the stuff they enjoy and less of the stuff they don't. We're having more engagement. We're having less turnover, which obviously costs a fortune if you have a physician leave for another organization. Quality of care goes up, patient experience goes up, you name it. So you can show the return on investment in a million different ways. And the more of those levers you can pull on both sides of the equation for the physician who's trying to decide, do I go to this thing that they're having me do on a Thursday where I have to go sit in a room with a bunch of people? Like, why is that worth my time? And then going to the CFO and saying, here's why it's worthy of developing and investing in clinicians this way. So I think if you look at it thoughtfully, depending on where you are in that continuum, and some people are shifting from one position to the other, then that attention on return on investment, which is not always just financial.
Hmm.
That was something that I had never really considered before really going back to school and getting a lot of formal training on the topic, but it's really changed the equation quite a bit.
Yeah. I mean, you mentioned the cost of physician turnover, and just to throw out, it's about $1 million for a physician
Yes.
to leave. And that's the recruiting costs to find a new physician. And then it's all of the indirect costs that are that come into play when a physician leaves. Typically, their productivity winds down. And when you have somebody new start, it takes a while for their productivity to wind up. Patients might leave, patients might complain more. There are more safety risks. I mean, there's a slew of indirect consequences of physicians leaving and the costs that are associated with it. So just wanted to highlight that. I think people are
I
always
agree.
surprised to hear that is like
Yeah, no,
$1 million.
it's
So
huge. And it's very easy to make very specific things to improve that the cost balance is just ridiculous. And I'll give you a concrete example.
yes,
So
please. I was going to
again,
ask.
CMO, small community hospital in Newport, Rhode Island. There was about 300 doctors. They would rotate to different hospitals, but we're on the medical staff. And then I had a chance to interface with some are department leaders, some are frontline, sort of just working in the trenches, et cetera. And my chief nursing officer was the one that really came up with this idea. And I thought it was absolutely brilliant. Is we were sitting around and said, you know what? People do exit interviews. So Dr. Sutton is at her wit's end. She's had enough of the place. She's like, you know what? I'm done. I'm out. I'm leaving. I'm going to go move to some other place. And then we would say, oh, Dr. Sutton, could you please sit down with us after you've made this decision to leave and tell us why you made that decision? What drove you to decide to quit and leave and move somewhere else? The whole thing makes absolutely no sense when you compare it to something like what we started doing, which are called stay interviews, which is where we sit down with you while you still work for us and say, why do you drive past other hospitals to come work here? When was the last time you thought about leaving? What is the stuff that makes you crazy? What's the stuff that you love? And you just ask some very open-ended questions. And if people are willing, it's not for everybody, but if people are willing to do it, I very specifically remember an encounter with a physician. And the physician said to me, if my previous employer would have asked and even took the time to care to ask any of these questions, I wouldn't have left. And it was just like my head, mind below kind of a thing. I'm like, why do we not do this all the time? And so we just started offering stay interviews to anybody that wanted them. Then we started pushing to say, I want to do a stay interview on all of my department leaders and like a certain percentage of the medical staff over a certain amount of time. I held myself accountable to just sit down with people, and just some people were like, this place is amazing. I live right across the street. My family's been here forever. I love the place. And you aggregate all of that information, and it's a Price is Right kind of a thing, like the top 10 answers on the board. And that's even motivating when you de-identify it and say, of all the doctors I interviewed 300 doctors, and 250 of them love this place. And they're like, oh my God, I could never picture myself going anywhere else. Like that is a huge lift when you publicize that. And then you say, of the bottom 50, these are the things that frustrate the most people. And these are some specific things that we talked about that we might be able to do to start chipping away at it. It's just massive. But the whole point, as I'm getting, hopefully makes sense, is if you just take the time to ask and you genuinely care and you just sit down with somebody, and it's not a performance review. I'm not telling you whether you're doing a good job or a bad job. I just honestly want to know, where are you on that continuum from absolutely love this place to I can't wait to get the hell out of here and I dread coming in? If I know where you are on that, that's huge. And if you're willing to share it with me, I mean, that gets into trust and all sorts of other things we can nerd out about, but it's just absolutely massive. But a simple stay interview is a tactic to attack that turnover, and just having a doctor be disgruntled and upset and leave. And they have good reasons when they do. It's all stuff that you would say, oh yeah, I totally get it. But if you get out in front of that, it's just massive, and you can turn the tide.
Yeah. I love that so much. It's so powerful. And it was something that my previous role we did pretty inconsistently, but we got really good feedback on it. And I agree with you so much that once somebody's made that decision to leave, especially for a physician, these are not quick decisions that physicians are making to leave. There is a lot that is goes into a physician leaving a practice. And so by the time they put in their notice, the ship has sailed. You can't get
Yeah.
them back, and they're not invested, so they're not as likely to share really what's going on. They're just going to say it's not worth my time, personal reasons. They'll check the box.
Right. Yeah.
But when you talk with clinicians that are there day in and day out, invested, and sit down with them and really ask them, it's so powerful. I really want to highlight what you're saying about asking them, what keeps you here and what can we do to keep you here? And I hear money being thrown around a lot about retention bonuses and that type of thing. And I was talking with a clinician client last week and talking about bonuses and raises. And I was like, be careful what you put money on, because one day you might not have the money, and
Mhm.
it can backfire also if you put money on too many things and it starts to become an expectation. And there's all these psychological components around what we pay people for. And so,
Mhm.
but just that human to human connection, just like you said, sitting down with them and asking what keeps you here is so, so powerful. I love it.
Yeah. Good. I'm glad that resonates. Thank you. It's obviously something I'm pretty passionate about. And
Yeah.
another book I'll throw in at you if you haven't read it, but Drive by Dan
Yeah.
Pink. Are you
Yes.
familiar with that one?
Yes.
So that one's, yeah, it's a perfect summary of how if you monetize some things, you can actually make performance worse.
Yes.
Fascinating. Just another mind-blowing experience.
Yeah.
But you're right. People, when it comes to fulfillment, which is a bit of a broad category we could spend a whole nother hour talking about, but I do think there's a lot of components, and being paid fairly and compensated fairly for what you do is a huge part of it. Don't get me wrong. And if you're below the level of what someone perceives as fair for their level of expertise and input, then there's no faster way to really upset somebody than making things unfair. But once you cross that line and you're above the threshold where someone's being fairly compensated, and that has to be a mutual, agreeable decision, then that's not where the contract ends. That to me is where it begins, is okay, table stakes, we're going to pay you fairly compensated for the market, and recognize healthcare margins are razor thin. A lot of places are hemorrhaging money trying to keep the doors open. Like this is not a place where we could really overdo it, even if we wanted to. We just don't have the funds to be able to do as much as we'd like. And for me as a leader, having those conversations with people, whether it's during the hiring time, during the stay interviews, during just conversations over the water cooler, is like, God, I wish that we had the margins to be able to just dump money and pay and do things and cool stuff.
Mhm.
First of all, let's put a pin in that one because I'd love your thoughts on what kind of cool, creative, innovative things we could do to try to generate more stuff without putting more on your back. Like, let's think about that and tap into their expertise because there's a lot of gold there. But then the other part is what other things, how can I give you, back to Dan Pink for a minute, how do I give you more autonomy? How do I set some guardrails? And within these guardrails, you do your job however the heck you want. And as long as it's getting done, I'm not all up in your face about it. So I'm not micromanaging you. That's got a value almost as much as a paycheck for a lot of people. And then how do you look at the mastery of how do you really, really become super good at something? And how do I then say, all right, well, there's a conference out in some beautiful state that's an ultrasound course or something you've always wanted to get better at or doing procedures or whatever the case may be. All right, well, let's free up a little bit of money and let's send you off to some course and have you become gathering more expertise, which is a win-win. Now you're an expert at something. Like that's just a duh. That's an easy one. And then that whole big bucket of purpose, like, reminding people that they're part of something bigger than themselves and how do you contribute? And that gets into reward and recognition and all the things that really cost little or nothing and have just
Yeah.
such a massive return that if it was an investment decision, you put in a tiny bit and you get a huge return. I mean, nobody would second guess it, but yet it's so many organizations that I've been able to be a part of or seen where coming in and really having a thoughtful reward and recognition program and not just pizza parties and buying donuts and things. Those have some value from time to time, but to really spend some time, and again, that's another topic we could spend an hour talking about, is the sort of right way and wrong way to do those sorts of things. And don't take my word for it. There's science behind all this
Yeah.
stuff. But if you nerd out on the science of why people feel appreciated and feel valued and understand what they contribute to the organization, and you just help them remember that and know that you see it also, if you can hit those things, it's probably not quite as much as a bonus or a raise, but it's pretty darn close. And if people feel like you genuinely care and are investing in them and their future, then you can get people to turn an eye a little bit towards, I wish I could give you a bigger raise than I can, but we're doing the best we can.
Yeah. And it helps with that hard work mentality too. I mean, people will work really hard for a cause that they truly believe in,
Yes.
and that you can ask a lot more of your team, and people will, like you said, will put up with a little bit more of the, hey, we're not able to give you that bonus or that raise right now, but here's what we can do and here's what we are doing. So
Yeah. I'm curious if I may, and this one may, you can be too personal, you can tell me to pound sand, but there are definitely things that people find energizing and then things that people find draining. And I know we've talked a little bit offline about this too for your own career and where you've led, you've focused more on the things that you find really energizing. I don't think you can know what somebody else, what charges their battery versus what drains their battery unless you sit down and talk to them. So I'm kind of curious. Obviously, you've crafted a pretty cool career. I don't know how your perspective on the things that you find energizing that you get up early and work hard for just intrinsically versus the thing that you find draining and how you've shifted. If you don't mind sharing, I'm curious.
yeah, I mean, I love coaching.
Yeah.
I love watching the light bulb go on with the clients and
Mhm.
watching not just the light bulb go on, but just to be a part of the journey with a
Mhm.
clinician from whatever that looks like, burnout to thriving or nervous leader to confident leader. I love seeing how much impact the client can have. So if it's a COO or CMO, what are they able to do in their team and their business and their practice with their patients, with their colleagues that they weren't able to do before? It just, the ripple effect is, it's like trying to imagine the size of the universe for me. It's kind
Mhm.
of mind-boggling. That really lights me up, and
Yes.
when I can spark that for somebody, that's what gets me out of bed every morning.
Yeah. No,
Yeah.
that's a great answer and obviously very authentic. And I think you can see how just thinking through that for yourself, and obviously you've spent a lot of time reflecting on it and speaking about it, which is great. But a lot of people haven't taken the time to stop and think about it. And so sometimes just as an icebreaker, I'll sit down with a new physician that maybe just started working or I've just met and just genuinely trying to get a sense of what it is that lights them up. And then look at what percentage of your job right now fulfills that or does something that gets you jazzed about it versus what percentage of your job is more the drain. And there's always going to be some stuff that just has to get done.
Mhm.
But there's actually some science behind this, and it doesn't have to be 80, 90%, even 20%. Like,
Eh,
but it's a critical amount. And if it falls below that, forget it. You're just dragging yourself. No amount of coffee will get you in the morning. But if it's above a certain threshold, then as a CMO, I can come at it and say, Laura, what can I do to help you just move the dial a little bit? Like, can I get you involved in something that maybe is exciting or a coaching opportunity? Or can I maybe hook you up with a mentor mentee situation where you can kind of see somebody light up and you can start to mentor somebody that's a little more junior? Some people might be like, oh my God, teaching somebody, that's like the worst. That would suck the life out of me. So it's not the right fit for everybody, but you see the points I'm getting at is if
Yeah.
you get to genuinely know what the dials are that charge people up, and then you genuinely care and you start to think about how can I help you build those things up. Now you're an ally and you're starting to help them career craft something that's sustainable for them
Yeah.
and not too far into it, you start to look behind you and you have a crew of people that trust that you have their best interest at heart because you genuinely do. You're looking out for them and then you're following along. And when you do have to ask them to do something that's in the 70, 80% of the crap that just has to get done kind of a thing, like you said, they're more energized, their battery's more charged up, and they're more willing to roll up their sleeves and dive in, especially if you're pretty savvy about explaining why it's important, even though it might stink, but you got to do
Yeah.
it. And of course, doing the hard work and the grunt work yourself doesn't hurt
Right.
either because they see you in the same game.
Yeah.
So
Yeah. That's so cool. That's so cool.
yeah.
Well, I know we've talked about this before, but I feel like we could talk forever. I do have to ask you though, because remembering that rereading that you trained in emergency room or emergency department at University of Pittsburgh, have you watched The Pit?
I did. Yeah, it's funny
What
you
did you
ask
think?
that. So I'll give you my quick summary of it. So my wife is an emergency physician too, so keep that in mind. And we trained in Pittsburgh. We were at UPMC, the university program, which is right across the street. The Pitt is at Allegheny General, which was a partner, kind of competing program, but we were collaborators. And so it wasn't the exact same place, but the town is the same. And so I'd gotten a lot of framing about it before I started watching it. Some people were like, oh my God, it's amazing. Some people were like, it's really hard to watch. It's very traumatizing.
Hmm.
So I watched the first episode, and I do have to say that the two things that made me pause was number one, it is very real. And I personally, part of my own sort of well-being is I don't love to be at work and run a hospital and deal with all the crazy stuff that's happening and like people and tragedies and all that stuff, and then come home and do more of it on TV. Like enough is enough for me.
Right.
So I personally like to switch it up. So I don't tend to watch and just enjoy on my free time shows that are about work. So I was already a little on the negative side. And then the other part that drove me a little crazy as a practicing emergency physician, and my wife, even more sophisticated and smarter than me, worked in a big trauma center and things, is basically take the two emergency physicians' careers and all of the crazy things that might happen once in your entire 20-year career, and you compress all of those crazy things into the first few hours of a shift. So I get why they
Yeah.
do it for TV drama,
Yeah.
but there were things that they were running from one bedside to the other bedside to do that she and I together have maybe done once in our entire career, and they've
Yeah.
done it all in one shift. So to me, it was a little laugh out loud
Yeah.
funny, which made it entertaining, but I kind of burned out from watching it pretty quickly
Yeah.
initially. But I have to say, it is incredibly well done. It's incredibly, just thoughtful and accurate, and just the emotions and the rawness is hard to capture. And they did an amazing job. So a lot of hats off to the crew that put that show together. But it is hard to watch for a lot of reasons, which is a good thing. That's not necessarily a bad thing.
Yeah. Yeah. Thanks for that. I listened to Noah Wiley on a podcast with Dr. Mike, and he talked about how really intentional they were, he and the producers were, about making this as a love letter to frontline clinicians
Yeah.
and frontline
Yeah.
healthcare workers. And so, yeah, I was curious to your thoughts. So thanks for
But
sharing.
if nothing else, if it gives people appreciation, and it's a bit dramatized to be fair, but it gives
Yeah.
people appreciation for what really happens in the emergency department. And a lot of it is absolutely spot on and real.
Yeah.
And it certainly paints the specialty and the nursing and the physicians and the support staff in a very positive light. So I'm a huge fan of that for the specialty, as you can imagine. But just know that we're not criking somebody in one room and doing a pericardiocentesis in the next room and then open cardiac massage on a trauma patient 2 minutes later. It's not a typical shift. It's a
Yeah.
little bit dramatic.
Yeah.
Yeah, somebody eventually is going to have the flu in there or COVID or
Right. Yeah. Or a UTI or
yeah,
something. Yeah.
exactly. Or just something you honestly couldn't figure out what the heck they're here for, even if you had all day.
Right.
I got nothing. Yeah,
Yeah.
that happens a lot too.
Yeah.
Yeah. Yeah.
Thanks so much for being here. So wonderful to talk to you.
Yeah, thanks for the opportunity. And thank you again for all of the content that you put out, all of the information, and all of the people that you've impacted, whose lights have come on and that you've energized. And you've really just helped them have a greater impact, myself included. So thank you for all the work that you're doing to make life more sustainable and more enjoyable for physicians in particular. It's really great.
Thanks. We'll include your LinkedIn profile for our
Okay,
audience
thank
so they
you.
can follow you. Is there anywhere else that you'd like to point our listeners to?
Yeah, that's pretty much where I've been focusing my energy. And I try to post a couple times a week, just something that either I find fascinating or maybe there's a piece that comes out that I think is particularly noteworthy. A lot of times things outside of healthcare, but then I think about, oh, wow, well, that probably is more as applicable in healthcare, if not more so. And so I try to kind of cross the line between other businesses and healthcare so we can kind of learn from the fringes there. So that would be the main area that I think people get the most out of. So thank you for sharing that.
Yeah. Thanks so much. So good to have you.
Yeah, you as well. Really appreciate the time. Thank you.
Thanks for listening to Designing Healthcare That Cares. If today's conversation gave you a new idea or inspired you to see things differently, share this episode with a colleague and keep the conversation going. And if you're ready to take the next step in building a thriving healthcare culture, you can find resources and ways to connect with me at drlaurasutton.com. This podcast is for educational and informational purposes only. It is not medical advice, and it should not replace care from a qualified healthcare provider. Always seek the guidance of your physician or other qualified professional for any medical questions or decisions.